Alright guys, so jumping right back into the video, I'm going to go ahead and start by showing y'all how I write on my whiteboard in order to study for pharmacology. So I really hope y'all enjoyed this video and let's get right into it. So at the top, I put the drugs that could be tested. So morphine, I'm not going to write all of them. Morphine, codeine, fentanyl, and let's put hydromorphone. So that's the top. And then I get into the common side effects. And so I try to make it clear, like, these are expected, because sometimes a question might say, like, what is expected with this medication? Or it might say, which of the following should be reported? And it'll have some of these common things, and that one will be like the kill you side effect. So if you don't know, you can kind of tell though what's life-threatening and what's like, okay, you have like, it made you nauseous, you're fine. So for opioids, the common side effects are narcs-U. They don't all have something cool, but some of them do. So common side effects, narcs-U, which is, I'm trying to think, I don't have it written out right there because it's been a minute, but I don't want to accidentally write it wrong because I know what I think in my head. Narcs-U. So the N is for nausea, respiratory depression, which is like respirations typically less than 8, is like really bad. I'm trying to think what the A is for. C is for constipation. So you learn that a lot of times if your patient is prescribed an opioid, you might want to try to get the doctor to get you an order for some sort of laxative or stool softener, just in case, or you might go ahead and give it with it prophylactically. And then urinary retention. So that means like, not really being able to pee. And another one with this one is orthostatic hypertension. And hypotension, I'm sorry. And so with that, I hope y'all can see this, but with that, when you change positions, your blood pressure drops, which we all experience, but that makes you like, and it could be like a little more severe. I can't think of what the A in narcs-U stands for, but yeah, that's that. And let's see, I said respiratory rate less than 8, but it's 12 for this. So if your respiratory rate is 12, that's when you would use the antidote, which is naloxone. So I usually write the antidote in red as well, because if you experience a kill you side effect, which out of that would just be respiratory depression pretty much, or sedation, then you would want to go ahead and, so that you don't kill them, use your antidote. And then what do you do? I just put, I'm not going to write all of this again, but I just put like respiratory rate less than 12, give antidote naloxone, reassess their pain frequently. Opioids are high alert meds. So if you've ever been in hospital, this is when a nurse is like, oh, can I get a witness? Because if I draw up a milligram and I only need half, then, which, like, let's say the vial comes with 1 milligram and I only need 0.5, then what I have to do is draw it all up, or even if I don't draw it all up, I can just draw up my half, but then for that rest of that bottle, I need to like pour it down the drain, or the special, sometimes they have a special, like kind of like a sharps container, but you're supposed to pour liquids in there because they'll incinerate that entire jug. with those medications in it. But you need a witness to waste that, because it's a opioids. People will get high off these too. They can. So the problem is that a nurse could be saying, okay, cool, pulling out a milligram vial, only giving their half, and then keeping that other part for themselves and getting high off of it. So that's when you need a witness for high alert meds. So for opioids, I just kind of know, but sometimes I would put like high alert next to the name. Because like this is a high alert med. Insulin, because someone has to check like your dose. And what else? Warfarin. Or no, I'm sorry. Heparin is high alert. Warfarin you can take at home. And then contraindications. So contraindications are reasons that like if you do this, you should not take this medication. And like there's a few medications that use in labor that are contraindicated with hypertension, just because a side effect is already hypertension. So if your blood pressure is already sitting super high, then I give you that, it's gonna get higher and you could stroke out. So yeah. So what they say is contraindications is GI surgery. I don't know why, but it's in the book. And then for cautious, you should be cautious if they have respiratory issues, because it could cause respiratory depression, if they're extremely obese, if they have GI issues, and if they have liver or kidney disease. And with that, when it's contraindicated for liver or kidney diseases, it typically just depends on where that medication is metabolized or excreted in the body. Because if it's excreted through the kidneys and you have horrible kidney function, then it's just going to sit in your body and build up, which could lead to toxicity. So that is what that's about. Okay, so I kind of wrote this out a little bit for you guys. I just put like the title at the top, opioid agonists. They're a high alert medication because you need a witness to waste the rest, just because people can get high and do like bad stuff with this drug. I put the title of like the drugs. When I was learning, in your book, it lists you like a bunch of medications that are this type of med, and you have to, we just have to know them all somehow. And sometimes you get like an easy one, like beta blockers, they all end in LOL, but opioids, you got morphine, codeine, fentanyl, hydromorphone, hydrocodone, meperidine, methadone, oxycodone. So some of them you get that own or whatever, and some of them you've heard of them before, but some of them don't. Like they don't necessarily all have like those same few letters. And then I have my common side effects. So opioids, it snarks you, nausea, can't think of the A, respiratory depression, constipation, sedation, urinary retention or like can't pee, and orthostatic hypotension, which is when you change positions and you feel like lightheaded because your blood just rushed or whatever. So for respiratory depression, you're going to count that in this case as your respiratory rate is less than 12. In that case, you need to give the antidote, which is naloxone. And then over here, I wrote out contraindications and the cautious, the one like diseases or whatever that you want to be cautious with. For like absolute contraindications, the only thing listed is GI surgery. And then sometimes they list a specific drug, like it says meperidine is contraindicated with kidney failure because it'll accumulate in your body, which can lead to seizures or toxicity. And for as far as the nursing actions, I wrote those out. They're just a little long, but like you need a witness. You should reassess their pain often because you want to know. And then also, now that I know more, I would probably go back and just write down that sometimes you hold off on giving pain medication because you don't want to mask the symptoms, and then a doctor come in and to like assess the patient, and they're like, oh, I feel great, and so now they're going to get misdiagnosed because they can't feel those symptoms. You know what I'm saying? So that is how I study. So basically, voiceover, lecture, joke cards. And then I just write on the whiteboard. Oh, I guess I could show y'all what I do. And then I would go, okay, so narcs you, I might go ahead and leave the narcs you part and make myself go back and fill that in. Contraindications, maybe I'll erase GI. Whatchamacallit? Maybe erase high alert, erase one of these, and then I'll turn around and try to fill it back in. And that way my mind is having to read it and do it, and I'm standing up usually, like if I'm in the library on like a fixed whiteboard like to the wall, and that way it allows me to just actively study and like get this stuff in my head. And yeah, that worked for me. Of course, also do practice questions, like ATI has them, they're online. And yeah, in the backs of each chapter of the book, just because you gotta try to, even once you have all the information memorized, you wanna make sure that you can put it into practice by like answering a question with it. And you come, like, even though I memorized like my drug cards for the, like to a pretty good level to where I remember things about each drug, but even if I were to be able to photographically remember each one, there's not time or space on my scratch paper to sit down and write out every drug card just in case. So when you see that one, you gotta be able to think, okay, it's an opioid, so narcs you know. So that's how I studied for pharm. And it was not as bad as it's not that bad. You can definitely get through it. It's very, now once I know these meds or learned them, like they stick. Because this was a year ago, and the other day, like I'm giving meds in the hospital on the patient side. What's this for? And I'm like, ooh, but my mouth is just like blah, 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 on my brain. So you can do this. Y'all got this. You will do great. And yeah, try to keep up with some of this stuff, because like right now I'm about to retake my pharm test from level 1. So I'm gonna make sure I read back through these just to jog my memory. So yeah, that is all I have to say. I'm gonna have to do some major snipping on this video because I think it's really long and I don't want to do that to y'all. But yeah, I really hope y'all enjoyed this video. Let me know if y'all like content like this, or what kind of more like other things that y'all would like to see. And like, comment, subscribe, follow me on Insta, and I will see y'all in the next video. Thank y'all. Bye.